Welcome everyone. We'll get started in just about 8 minutes. We'll be using the question box today to communicate. So if you want to go ahead and type in there and tell us where you're from.
And also tell us what time it is, wherever you are, because I will tell you as a member of the East Coast ruling elite that I have found dealing with all these times to be extraordinarily difficult. You know, when I get the thing saying it's on, Central Time, I'm going, no, wait, is that an hour before me, an hour after me? And to really throw me off, they posted some things in Greenwich Mean Time, and that really threw me for a loop. So also when you tell us where you're from, tell us what time it is there. Okay, if I can read this, I think. It's 9:52 a.m. in Philadelphia from David. I'm trying to figure out why. Kim Tate, Green, in Pueblo, Colorado. It is 7:53 Mountain Time. Deborah is in Elizabethtown, Kentucky. Time is 9:54. By the way, Elizabethtown, Kentucky, I am enjoying, if I get this in front of the camera, a late one soft drink. I only drink these when I need an extra caffeine boost, and I've already had my 2 cups of coffee. It's bottled near you folks down there somewhere. It is my favorite. I go through maybe two cases a year of it. I only use it when I'm going to have to be on for some meeting or something. And Mariah, for some reason, I'm having trouble getting my question box to open up properly.
Okay, is it still docked in your control panel?
Yeah.
So there's a button on the right-hand side that's like a little square with an arrow coming out of it.
Yeah.
If you click that, it'll undock it and you can resize it.
Yeah, it didn't help that much.
You should be able to make it pretty big if you just drag it from the sides. The arrows should show up.
My apologies. We're having, this is frustrating to me because I'm having difficulty getting the answers to come in properly. Treasure in Oklahoma. Hi, Treasure. So welcome. This is Christina Folsom. We'll be talking about building a network of diverse social services. We'll be starting here in about 1 minute and 15 seconds. I'm going to be setting my timer soon so that we do not run over. Mariah, are you still on?
Yes, I'm here.
So when we get done with this, just a reminder, when we get done with this, then there's a half-hour break, and then we have the concluding session presentation by Ruby, correct?
Yes.
And for them to go ahead and access the presentation by Ruby, what is it that they need to do?
So they should have all gotten the link for that.
Okay.
It'll be from GoToWebinar.
Okay. All right, and so just press on that, and that'll be starting a half hour after this timing ends. And the timing on this is after doing this now for 2 days. I have no idea what time zone I'm in, so all mock me later. And in case anybody's wondering, no, this is not going to be my permanent hair, but this is my COVID hair. Okay. And this is what it looks like when I haven't seen the barber since March 5th. So, all right, we're 1 minute away. So I do want to welcome everybody to this session here with Christina Folsom from Tyler, Texas. I've been to Tyler, Texas. It's a wonderful town. I was also fortunate to be there when Christina had a conference there that in a metropolitan region that was about 120,000 people. I think she had a third of them in her building there because it was just huge and massive. But they're doing some absolutely remarkable things. And I think you're all going to get some very good hints and helpful techniques to go to when you go back home to be able to go ahead, or actually you are at home, sorry. But as you be able to take this out and work this in your local community. So with that, without any further ado, Christina.
Good morning, everyone. I am really pleased to be able to do this presentation. Building a network of diverse social services is difficult at best. And I'm going to give you a little bit of history of why it was that we built this network, but I can tell you that it didn't gain any traction until we all agreed on the data, until we all agreed on what the problems were and how we were going to work together to address them. So first, what problem are we trying to address? This is just a little bit about me. I don't need to read this to you, but what I do want to tell you is how this came about. I was the executive director of a large nonprofit in Smith County, Texas, that provided poverty alleviation programs. And one of the things that I volunteered for was to run the Smith County Coalition for the Homeless. As soon as I started that, and in having built relationships with people experiencing homelessness, I recognized that I needed to bring to the table additional players. I needed to have people there that focused on education, on employment, on health, on behavioral health, obviously on housing and in transportation. And when I invited those people to these meetings, they didn't come. They were all partners in the other organization for which I was the CEO. So I worked with them all the time. But when I invited them to the Smith County Coalition for the Homeless, they didn't come. And they said because they weren't focusing on homelessness. They already had their plate full. They were busy. They couldn't do it. And so all of us know, I'm sure all of you know, those especially addressing homelessness, that every individual needs help with education and employment and health and transportation and childcare and so many other things, that each one of us is a complex human being that needs a lot of resources. And of course, we know that also from the work that we do with Bridges Out of Poverty, all the resources that we need. But these were resources that we began calling stabilizers. So that's how we got together. I decided to leave that other organization and started the East Texas Human Needs Network. It's been in place for 8 years now. We call ourselves Ethan because it's so much easier and it's cute. It's like I have a son named Ethan. And for years, when I talked about Ethan, people didn't know what I was talking about. But it's about an organization, Ethan, the East Texas Human Needs Network. This time, when I invited all of those same players to the table, they all showed up. So it was wonderful. I love the work that I do with them. But here we all were together, all of these players from all these different sectors, and how would we agree on what we were going to work on? We all agreed that we needed data. There's data available. There's data readily available. That's state and federal data. It's not detailed enough. It's not specific to local needs. Every community is a little bit different. We also all agreed what we had in common is that we were helping others. We did it in a variety of ways, but that's what we all had in common, is we were helping others. But now we needed information. I had already started delving into, hadn't become a facilitator yet or a trainer for AHA process, but I have since then. I had been studying a lot of that material, and I said, okay, let's go to the under-resourced, let's go to the people who live in poverty. Let's ask them what the greatest needs are. And let's not ask them in the ways in which we've done it so many times before, where somebody in a literacy program asks their clients about literacy. Somebody with a food bank asks their clients about food insecurity. Somebody in homelessness asks someone about homeless services and housing. Instead, we needed to ask everyone about all of it. So we designed a comprehensive community needs assessment. And it is that data that we brought back to the table. We worked together to design it. We worked together to collect the data. We worked together to analyze it and then establish goals from it. That's how all of that came about. So that's the information I'm going to share with you, is how to put together a comprehensive community needs assessment for your community, something that will work for you. This presentation is sort of like the additive model, right? We're going to talk about one thing and then add to it and then add to it and then add to it, and you will see all the steps in the process. So let's go ahead and get started. We're going to start first. We have Mariah, who is helping us, and we have a poll that I'd like for you guys to respond to. If you could share that poll with us, either Joanda or Mariah, that would be great. Can you guys see it? I don't see it yet. Mariah, can you unmute yourself and let me know where we stand on the poll? Okay, well, we're going to move forward without it because I have no indication. I can't hear anyone telling me that the poll is out. So let me just go over what some of these questions were and what I expected the responses were going to be. So one of the questions was, or the first question is, oh, it looks like we're opening a poll. Hold on. Distributing the poll. Okay, it looks like it's going out then. Thank you all for responding to the poll. There are 3 questions in the poll. The first one, of course, is what one complex social issue in your community would you like to address? And there are 5 possible responses. We're still collecting data. Okay. Sharing poll results. Okay, I guess you can see the results. It doesn't look the same on my screen. It looks like 30% of you said you would like to focus on educational attainment, 12% on unemployment, 12% on lack of healthcare coverage, 22% on homelessness, and 25% on lack of transportation. And the point that I was trying to make here is if you had 10 people in a room and you asked 10 people, what would you like to work on, often you get 10 different answers. So in this case, it looks like all of us are still all over the map, primarily in educational attainment, since our process is an education organization, and then lack of transportation, all of us seeing that as a barrier. Let's go ahead and look at poll number 2. Mariah, if you could release that. If you presented that one complex social issue that you decided would be the most important to your community colleagues, would they agree with you? Would they agree? Just a few more. It looks like about 70% of you have voted already. Okay, so here are the poll results with the majority of you voting. You said that yes, you believe your colleagues would agree with the social issue, complex social issue that you selected. A third of you said no, and a third of you said I don't know. I would combine those two to be 60% aren't really sure whether or not their colleagues would agree that that is the most complex social issue that you can devote your resources to. And now let's go on to the third poll. The third poll is, if you presented that one complex social issue to the under-resourced in your community, the people that you serve, the clients of the community, those that are living in poverty, generational poverty specifically, would they agree? Would they agree with what your first choice was? Let us know what your answer is to that. Thank you all for voting. Just a few more. Okay, here are the results. To the question, if you presented that social issue to the under-resourced in your community, would they agree? 42% of you said yes. That is wonderful. That is good. It means you really have the pulse on the community. You understand the people that you serve, and so you understand what their greatest barriers are. 25% of you said no, probably not. Our under-resourced community might not agree with that. And 33% of you said, I don't know. So again, we're looking at about 60% of you really unsure whether or not what you believe is the greatest need in the community is in fact the greatest need in the community. That's kind of a trick question. The truth is that it's not any one of those issues. Now, if you have limited resources and you can only work on one thing, as a community, a collective impact or collective action effort, then this kind of assessment would tell you this is where you invest your time and your resources and your partners and everyone's in-kind gifts and monetary gifts and time gifts. However, we know that poverty is much more complex than that. We know that we have to work on all of these stabilizers at the same time to really give people an opportunity to stand on their own. That if we help with one thing but not the other two, that they're going to fall. That we have to really work hard to reinforce each other's work, to build a continuum of care so that people in need who have a variety of needs have all of their needs addressed at the same time. I'm going to tell you a story, and it is what led me to start this, the Ethan organization. Many years ago, my friend Anna called me and she asked if I could be at her house at 3:45 that day to pick up little Rudy. And I loved little Rudy. He was just a bundle of energy. He was adorable. I checked my calendar and yes, I could be there. I was able to go. And she asked me if I still had a key to her home, and I did. I had a key to her house. So I said, I will be there at 3:45 to get little Rudy. I had met Anna years earlier. Anna had come to the organization where I was the CEO, the PATH, it was called PATH, People Attempting to Help. She had come in for assistance. She had come in through our lobby. She had filled out an intake form. She had been called back to meet with one of our volunteer case managers. And the case manager asked, how can we help you today? And Anna couldn't speak. She couldn't speak because she couldn't catch her breath. She couldn't catch her breath because she couldn't stop crying. And so they sat with her for a little while, hoping she would calm. They brought her a glass of water. They asked her again, how can we help you? And then somebody said, Christina, we need you to come and meet with the client. We can't get her to calm down. So I'm not magic. All I did was the same thing they were doing. Came downstairs, I sat down next to her. I looked through her intake form and I saw that Anna had a husband named Rudy, a daughter named Angela that was 12, and a son, little Rudy, that was 7. And when she finally caught her breath, it was one of those, and then you can finally speak. Most of us have had those moments in our lives. It was a painful time for her. And she said she was there for food, that she needed food, that it had been really difficult for her to come in for assistance. And we knew that, we understood that about the people that we served in that organization. But it was much deeper than that. So what she ultimately told us was that Child Protective Services had been called, that someone was alleging that Angela, their 12-year-old, was being abused. And she told me a little bit about Angela. Angela was 12 years old. She was a little overweight, but she was a straight A student who loved to read. But she wasn't doing well in school because she was bullied all the time. People were mean to her, so she wasn't doing well. Well, as things happened, a week earlier for our mentoring program, we had a children's mentoring program at the organization. We had a retired middle school librarian sign up to become a mentor. So we matched them and she started thriving. We got the medical records finally, or the research from CPS that closed the case, that said that Angela had brown patches on her cheeks, and it was the reason that they had reported that they thought she was being abused. Those brown patches on her cheeks were actually an indication that she had type 2 diabetes. It was hyperpigmentation. The medical exam showed that she had type 2 diabetes, she had high cholesterol, she had high blood pressure, and she was morbidly obese. Was it a form of abuse? Some people might say yes. The family was doing what they knew how to do in taking care of each other. So she started going to nutrition classes as well with her mentor, and they started thriving. The whole family was doing better. And then one day the mentor came by to see me, and she said, "Do you know where they live?" And I said, "No." She said they live in a trailer. So if you imagine the trailer as a block, the top corner had split open. And so at the top in the corner, it would peel open, and they've put lots and lots of tape, lots of tarps, and still the elements were getting in. The landlord refused to do anything to repair it, and the house was filled with mold and mildew. What I also didn't know at the time is that little Rudy had asthma. And little Rudy was missing school a lot because he was having asthma attacks. He was going to the emergency department, and he was being even hospitalized twice the prior year. And it was all because they were living in a sick house. So now we've determined that they live in a poor place. And so after a month and a half, 6 weeks or so, we were able to move them into a healthy environment. So little Rudy's health started improving. Then one day, little Angela is running through the lobby because we had a children's library in our building. And she stopped and she said, "I need to tell you something." And she said, "No, I'm not supposed to." And I said, "Well, don't tell me if you're not supposed to." And she said, "Mommy's not getting up in the morning." And I said, "What do you mean?" "Well, she stays in bed all day and she cries a lot, and she's not taking care of Rudy to get him ready for school. I'm taking care of him." And so we didn't find out until Angela told us that Mom, Anna, was suffering from depression. So again, another one of our partner organizations, we were able to get her in to see a physician. We were able to get her in for counseling and for psychiatric care. They started treating her depression, and she started doing better. Now she wanted a job because she was doing so much better. So she took computer classes. And with the computer classes, she got a job at Suddenlink, which was a big cable company in our area, as a bilingual customer service agent. I mean, it was just wonderful to see the growth. But it was very little at a time because we were learning about the issues only a little bit at a time. So one day, Big Rudy comes in my office, and I had met him before. He was a bear of a guy with big smiles and giant hugs. And he said that he's having trouble getting and keeping a job. And it's because he had a criminal background. He was an ex-offender, and he was having a hard time finding a job that was sustainable. So he asked if he could help, and I told him, "You can volunteer for us." We just changed our food pantry to a choice pantry, one in which the clients get to come through the pantry and select from the shelves the things that they know based on an allowance that their family will eat. And so he started volunteering there. He was there Monday through Friday, 8 to 5. We worked out a deal to cover all of his expenses at the house that he lived in, because it was one of the homes that our nonprofit owned as well, and that we rented for very low rent amounts. So he was working there and volunteering. He was changing the culture of the pantry. The volunteers had been used to having a wall between them and the clients, and they were really uncomfortable with having the clients come behind the wall or behind the counter, and he changed all of that. It was wonderful. And then one day I got a call from a friend who was running St. Paul Children's Foundation. Their pantry was getting busier. They wanted to change to the choice pantry model, and they asked if I knew someone that they could hire. And of course I did, Rudy. So they hired Rudy. So Rudy started managing that food pantry at St. Paul Children's Foundation. That morning that Anna called me, I went to the house that afternoon. I was peeking through the window, making sure there were snacks. I saw the bus come up. Little Rudy came running, almost knocked me down. Came in. I asked him if he had homework. And of course, 7, 8, 9 years old at the time. Nope, he didn't have any homework. He just wanted to watch cartoons. So we did that. And then we went out to a playground that was behind the house. And I was pushing him in this big tire swing when I could see Mom was driving down the street. They lived in a corner lot. So she was driving down the street and making the turn to come into their driveway. And it was Anna, and Angela was sitting in the passenger seat. And as soon as I saw them, and then I looked back down at Rudy, it took my breath away, because his whole world was about to change. What had happened that morning was that Big Rudy at the food pantry at St. Paul's had suffered a massive heart attack. And Rudy died that morning. So his entire world, everyone's world, changed forever. It was a heartbreaking experience. We knew the family. We had known the family for several years, and yet we didn't know. I asked Anna what had happened, and she said that he was diabetic, Big Rudy was diabetic, that he hadn't taken medication, that he hadn't seen a doctor. So he had organ damage, and he died of a massive heart attack because he didn't have medication. The worst part of it was that our organization also had a medication assistance program, and he could have been getting his medication for those 2 years that we knew them and taking it every single day. And when I asked Anna why we didn't know, she said, you guys were already doing so much for us. He didn't want to ask for one more thing. I tell you this story because it opened my eyes and the eyes of so many of us working in this field. We recognized the issues that they were facing one little bit at a time over the course of 2 years, and we missed something that could have been an easy question, but that had fatal outcome. We simply were not asking all the questions that needed to be asked. And so now, as a community, we have the tools in place so that regardless what work you do, you might be running a shelter for people experiencing homelessness. That doesn't mean you can't ask about medical needs or psychiatric needs or education or transportation. Everyone needs everything. That's really what it comes down to. So now we have all of these organizations coming together, and we're trying to determine, like we did for that family one little bit at a time, what is the gap? What is the gap between what is their situation right now? What should that situation be instead? What is the gap? And we could determine that by doing a community needs assessment. So how do you determine the need? There's lots of information out there. And like I said earlier, the information that's out there is usually not as detailed as you need it to be. So determining the need is the data that's out there is usually not local. It's usually not detailed enough for your program. It's really based on that isolated impact paradigm. So there is data out there about food insecurity, about homelessness, about educational attainment, but it's not whole data, whole human data. It's really isolated impact data. And the reason that happens is because we rely so heavily on state and federal population level data. The reason it happens is because we're relying on local experts who we call experts only. And at the time, and in most communities, we see the executive directors and CEOs of nonprofit organizations as the experts. And yes, they're very knowledgeable, and yes, they need to bring all of their knowledge and resources to the table. But the experts really are those individuals that are struggling to make ends meet. There's also a belief that capturing this kind of data is difficult. It's difficult, and it truly isn't. But then what happens when you follow this model of using only what's publicly available and talking only to CEOs, is that programs are often designed based on incomplete information. You don't have all of the information that you need to really build a good program, and clients are not participating or progressing. So just like we did earlier when we did that little assessment and we asked, what do you think is the greatest problem? If we went with that, if we all assumed, okay, we agree that's the greatest problem, let's design a program, and then people don't show up, it means we missed something. Not only did we miss something, we have burnt through time and money and staffing and heart that we pour into programming. And so the solution, as we saw it at Ethan, was a comprehensive community needs assessment that really was capturing the voices of the experts in poverty, which is those individuals who are living in poverty. So that's what we're going to talk about today. That was sort of laying the groundwork. So we're going to capture the voices of individuals living in poverty. We're going to do a comprehensive community needs assessment. I'm going to show you what the purpose is. This is something that you can also use if you are convinced after today's webinar that this is something your community could use. You can use this very presentation to present to your colleagues, to your staff, to your volunteers, to your board members, to your philanthropists, to see if they also feel at the end of this that that is the next step to take. And it's something that you don't necessarily have to go out and hire a consultant to do for you. This is something that you can do step by step, following this guidance on your own, as long as you have enough champions in your team. And most communities do. So we're going to talk about the purpose of the assessment, how to design it, how to collect the data, and then how to do the data analysis. So the main purpose really is to identify those circumstances, right? That gap between what is and what should be. We're looking at what services already exist in the community, and then you can see what is needed and do we have the services for it. We're looking at then the opportunity to respond to that need because you found what the gap was. And then for networking and collaborative programming, the opportunity when all of you gather the data together and all of you believe in this information, you're already sitting at the table. You're already having the conversations. And you may find that you have strengths that another organization doesn't, and vice versa, and that together you can fill those gaps. It's also very important, actually logistically, of course, to provide the data, the actual hard data for the program design, for the program evaluation, and then for funding requests that are identified in the data. This is usually the first time in a community. Many communities have small family foundations, philanthropists that fund many of the very crucial programs in our communities. And often they receive a multitude of applications, but it doesn't have the same data to support the same type of programming. This would be data that they would receive even from 5 different organizations that's identical. It's the same data. We're looking at hard facts that we all agree on. So we're going to educate our service providers, the community at large, our local, state, and government, and of course the philanthropic community that's going to help us make this happen. And when it comes to building trust and relationship with those individuals that you interview, with your clients, you're going to be able to give them a voice. Their voice will be heard in a way that it hasn't been heard before. So you'll be able to speak on their behalf and or through coaching and guidance and support, allow them to speak for themselves. So this is the place where I'm going to pause to see if there are any questions regarding just this section of the presentation on purpose. What questions do you have about purpose? And if you don't have any questions, we will move on to the next slide, but I want to see if anyone has any questions. I don't see any new questions over here on the chat box. So I'm going to move on.
Look in the question box also.
So answered questions. Okay, here we go. I'm going to unlock this section. Sorry, guys, as I look through these questions to see if there's anything here. So at this phase, education is to the community leaders. Yes, absolutely. Once you have all of this data, you're actually going to be educating not just community leaders, but all of your partners, all of your volunteers, boards of directors. It's really education for an entire community. Is there a handout for this presentation? Yes, absolutely. There is. We will have the link to this PowerPoint presentation. All of you will get a copy of this presentation that you can share with others. Do you have any tips for collecting current housing data for a community? Yes, we do. Let me get to that section where we're doing data collection. And if I can't answer that question during today's assessment, you will have my name, my phone number, my email address. If I'm not able to answer your question, please, please, please send me a message. Send me a text message or send me an email, and I will do my best to answer your questions. Okay, so let's move on to the research components of this presentation. So what are the research components? What things do we want to do? Let me close this out because it's not letting me click. Okay, so the first thing that you want in your assessment is demographics. We do demographics at the federal level, at the state level, regional level. We tend to capture demographic data. And there were years ago that I used to say, well, what difference does it make if there's a need and the need is great enough? It's like now we're doing all of our research on economic classes instead of looking at the breakdown of race or ethnicity. I used to think, well, but I've changed my mind. I've changed my mind because you can't look at disaggregated data and understand that there is disparity, that there is a lack of diversity, that there is a lack of equity without looking at those details. So it's important that you capture the demographics. And it's not just the race and ethnicity demographics. You also want to know, are they married? Do they have children still at home? Are their children still at home? What else is going on in their lives? What indicators can we look at to disaggregate from, also so that there are subpopulations within the data that you can help support. Economic well-being. Economic well-being are questions about their income and their expenses. They are questions about, it's also asking how many family members you have, so that then you can ask what is your income, so that then you can determine whether or not they live under the federal poverty line. But it also helps you determine for your community, based on the living wage, how many of the people you are interviewing and serving through nonprofits, how many of those individuals are not able to make ends meet. So it's economic well-being. We've also added questions that have to do with whether or not the respondents have any payday or auto title loans. We're starting an initiative in our community. In the state of Texas, 45 cities have already passed unified codes, ordinances, to try to cap payday lending and title loan lending. That's not happening in our community yet. So it's information that we're beginning to gather in order to do that. And then what research areas? You know, when I talked earlier about the stabilizers, about those 5 areas of stabilization, education, employment, health, housing, transportation, that's what we mean by research areas. So here are those 5 research areas. For your community, you may want to add something else. We have done a subset under health that is about behavioral health. So we now have behavioral health. But your community, you may want to assess something different. Just make sure that you're not so narrowly focused that you don't get the big picture on what people's needs are. And so then what are the key indicators? The key indicators in our assessment gave us an opportunity to focus our attention on the needs of those individuals that had a specific key indicator. In other words, don't try to address the needs of everyone. Try to address the needs of people who have these very specific key indicators. So under education, we were looking specifically at those respondents that had less than a high school diploma. For employment, how many of them were not employed, experiencing unemployment? How many people didn't have healthcare coverage? How many people were experiencing homelessness? And then how many people lack reliable transportation? All of this information gives you a whole picture. How many people are actually facing all of these challenges at one or multiple challenges? But it also allows you as a service provider perhaps to focus just on the education data and just on those individuals that haven't finished high school. So who are the stakeholders? I told you that we had invited to the table representatives from all those different areas. So we developed a planning group that was made up of individuals in education, employment, health, housing, and transportation. But then critically important is to ensure that you have clients, that are going to look at this assessment, that are going to help you develop this assessment, that are going to make sure that it's written in the right register with the right words that people in your community use, and not with sort of the terminology lexicon of the nonprofit sector or information and referral organizations. So these are all the people that are going to help you design the assessment based on what questions do they need answered in order to be more effective at program design and at program implementation. So really each of them provides a service in that realm, and they can tell you what questions they need answered. And those are the questions that go in the assessment. Now, it's critically important also that you add legitimacy. And I don't know how many of you face this, but I know that I worked in the corporate world for many years before going into the nonprofit sector. And we tend to think of people in nonprofit as people who have very kind hearts and they're very sweet and they're doing their best, but it's not very strategic. It's not very purposeful work. It's just we're led by the heart, and we are led by the heart, but there's so much more than that. And so in order to add legitimacy to your assessment, we partnered with the University of Texas at Tyler. It happens to be the branch that's in our community, and we got IRB, Institutional Review Board approval. But what comes with that is a form of strategic guidance. What the university was able to provide for us is research ethics and compliance training. It's a way of ensuring that all of our interviewers, people conducting interviews, were following a model that's called human subject research training. Make sure that there's informed consent, that there's privacy and confidentiality. All of those things were critically important for us in the implementation. But also, once you have the data, having that little stamp that says IRB approved makes the material, makes the data that you've captured more credible. So here we are in the design phase. I'm going to open up questions again to see what questions we have in our group. Do you guys have any questions about the design phase? Let's see. Dental is often overlooked in health too, absolutely. Dental, I've been doing needs assessments for 20 years, and dental for the very first time last year was not number one. In the past, whether you did community-wide assessments or a subpopulation, like people experiencing homelessness, the need for dental care was always number one. As a result, in our community, several dental programs were established between 2013 and 2016 and are continuing to grow. And so when we looked at our data, and you'll see it in a few minutes, the need for dental care went down because more people are actually able to access that assistance. Let me see, dental care. Do you do this yourself or contract with an outside entity that has expertise in community needs assessments? No, this is us doing it ourselves. This is our organization. We would probably be defined, Ethan is probably defined as a backbone organization, as a convener, as a neutral party that brings everyone else to the table. So we're facilitating, we're providing not just the strategic guidance, but sort of the logistics of this. But we don't do it alone because we have partners in every one of those other organizations. So no, we're not contracting with anyone else. We've done tremendous research. We do have a partner at the university, but we're actually doing this ourselves. How long does the process take? Let me see. How long does the process take? Well, the first year, it took a year to design the assessment and then implemented, gather the data, probably a year and a half. But now that we've done it 3 times and we do it every 3 years, it takes probably 6 months from beginning to end because you're starting with an existing assessment. You already have partners. You're going in to edit the material that you already have. And then you're also building that trend line, right? You're able to see what has happened over the years. So it doesn't take nearly as long as it used to. Can you review legitimacy information? Legitimacy information really is that stamp of approval that comes from the university, and the university can only give you that stamp of approval if all of your interviewers have gone through ethics training. It's a university program. They have to go through ethics training. It can be live, in person, or online. And only those that have that certification, that have gone through the ethics training for research of human beings, are allowed to interview others. That's what gives this assessment credibility. Maybe legitimacy is not the right word. Maybe credibility is the better word for that. Does the design involve focus groups or individual interviews, surveys? What do you find works best? Do you use different methods with different groups? Okay, so the assessment, the implementation of the assessment, which we'll go into that phase in just a moment here, but it is about experienced case managers who have relationships with clients within their organizations, interviewing face-to-face, one-on-one their clients. That's how we do it. We gather data one by one. Interviews can be anywhere from 30 to 45 minutes. And then we also know some of our clients might take an hour. But it is an amazing opportunity to learn, gather as much information as you can. The survey itself is on Qualtrics database system. It is housed at the university. It is done online. So that is how we do it. We do it one-on-one with individuals. What is the time frame to get it done? I would say if you're getting started, if this is the first time you've done this, it's probably going to take close to a year. One, because you have to have buy-in that you want to do a community needs assessment. Two, you need your partners at the table. Three, you have to start designing. What questions do you want to ask? Partner with the university. All of those things have to happen. So I would say first year may not take as long as a year, but you work on it a little bit each month with all of your partners. At Ethan, we meet monthly. And so we would work on different stages of this process every single month. We would move on to the next one, move on to the next one, do the implementation, gather the data, analyze the data, move on to the next one. So it takes time. Okay, I'm going to close the questions again and move on to the next. Data collection. So this is the part that I feel you're already leading to, that everybody has so many questions about. So under data collection, who's gathering the data? What are we gathering? When? Where? And then how? How are we doing that? So I've hinted to some of this. Under who, CCNA, I'm sorry I didn't write it out, but that means Comprehensive Community Needs Assessment. So CCNA trained and certified caseworkers in participating agencies. That is the key. We've made that mistake where we didn't have enough staff members and organizations to interview, and so we enlisted volunteers. Volunteers, many of them were nursing students who went through all of the training program, but when they approach someone and ask, hey, will you please sit with me and go through this needs assessment interview? Most of the time the answer to a volunteer is no, but the answer to the caseworker that they already know is yes. So who is critically important? What is the face-to-face interview to respond to survey questions? When you set up a time frame. The first time we did it, we set 1 month and we realized it's not enough time. So we expanded it to 2 months of time within organizations. And I'll tell you who's actually going to be partnering and gathering the data. Where it's going to be scattered sites. It's going to be all of the Ethan member agencies that said, yes, we want to volunteer, we want to help, we want to gather this information from our clients. So those member organizations became our partners. That's where the interviews were taking place. And then how is that interviewer, that certified caseworker, is accessing a password protected survey that's part of the Qualtrics system. It's online and they're entering the data into a system. So the data that we're capturing is quantitative data. The reason it's also qualitative data is because of the thought that went into writing the questions and writing the possible responses. So it is a quantitative assessment, but it includes a lot of quality because of that design process. So then who are our partners? Our partners, you're going to recruit partners, are going to be usually people who are already at the table. So when you gather and invite all of your community partners in education, employment, health, housing, and transportation, childcare, veteran care, behavioral health, whatever it is, you have them all in a room. From within that pool, you recruit partners that will sign a very simple memorandum of understanding. The MOU simply says, we're going to be your partner. We're going to give this process access to our clients through our own case managers that will interview them. You're going to train and certify your interviewers. That is a very, very important step you must do. Working with the university, you schedule the training, you send out a doodle request to see when the majority of people are available. We were able to do it as a live Zoom. We were able to record it, and then we also had it in classrooms at the university. So all of the training of interviewers was taking place. you're scheduling the interviews. Some organizations, based on their own workload, would say, you know what, the month of June is impossible for us, but we could do it for 2 weeks in July. You say yes to whatever they offer, because you need them. You desperately need them to interview their clients. So you need to be flexible. And if you need to expand the time period in which you gather data, then you can do that. You can extend it. And then as the organizer, in our case, Ethan, we make sure that we're monitoring, that we're looking at the data regularly, because we can look at Qualtrics. We have a partner at the university, a grad student at the university, and I can call him every day and say, okay, how much information have we gathered? How many interviews have we gathered? And then we have a list of interviewers that are certified. So we look at that list and we say, okay, who hasn't conducted an interview yet? And we call them and we say, hey, can we help you? What's going on? Why haven't you been able to conduct an interview yet in this process? So that is the collection process. Let me open up questions again, and you guys let me know if you have any questions. Okay, what is the cost for research approval? In our case, there was no cost for the IRB. There was cost that we chose to take on by hiring a grad student that could help us for an entire semester. And it was minimal. I know $3,000 is a lot of money, but when you think about it in this, when it comes to this, $3,000 I think is what we paid for a grad student for 1 semester to help us facilitate this. What is the name that I said? Not Qualtrics, but Qualtrics. Qualtrics, I think Qualtrics is the name of the database. What were the top 3 biggest challenges in developing the project? What would be 2 future goals your organization would like to accomplish? From sunshine, smiles. I like that. A lot more detail than I can get into during today's presentation. But definitely we faced challenges. Last year, the greatest challenge we faced was that most of our partner agencies said that they did not have enough manpower to conduct the interviews themselves. And frankly, the data showed it. At the end, when we'd been spending 2 months collecting data, we didn't gather as much information as we had 3 years prior. And the one thing that was different is that instead of having the case managers who have relationships with their clients, we had a lot of university students who were trained, but they got more no's than yeses. So that is one of the biggest issues that we face. Let me see what other questions, a couple more. What is a good number on how many people should be interviewed by each agency? You probably want to look, the university will help you determine what is a representative sample for you. For us, a representative sample was if we could get over 1,000 responses, that would be amazing. We didn't get over 1,000 responses. So then we looked at what we did gather, and the university looked at that and they said it was still a representative sample, so we went with it. I was heartbroken, but we went with what we had. Okay, so then you can get help with that. There's also a lot of data on the internet on conducting assessments and what a representative sample would be. What are some points you go over with caseworkers in training for your survey? There are specific programs that the university uses with curriculum. There are 3 different modules that the university uses to teach. And I will make sure that I put that in my notes, the process that they go through to teach ethics and research with interviewing human beings. So I'll be sure to give you that. It's really about respect. And so the other thing that is important is that one of the first things that the interviewers learn is that, 1, make sure your client knows, the person you're interviewing knows, this is voluntary, this is anonymous. You don't have to answer questions that you don't feel comfortable answering. You can skip it and go on to the next one. You can stop at any point in time. These interviews are really lengthy as far as time goes. And so there was a concern about that, clearly it should be, because some people are busy. They couldn't stay there for 30 to 45 minutes for an interview. But those that could, at the very end, we ask one question, which is there something we didn't ask you about that you would like to share? Most of the time, there wasn't anything else that they wanted to share, but they said, no one has ever asked me these questions before. This sense of, wow, somebody cares enough to ask me these questions. So very powerful, a lot of responsibility. As you can imagine, when you're gathering this information, you're giving someone a sense of hope. They know what all the barriers are that I'm facing right now. And in time, you can't make any promises when you're doing the assessment, but in time, there are going to be resources for all of the barriers that our family faces. Let's see what else. The training timeline is, it's probably takes a full day over the course of a week. The workshop itself is only an hour long, but there are training modules and tests that you have to take online. Qualtrics is open market. Okay, I'm going to move on to the next slide on analysis. So now we have gathered all of this great information, and we want to start looking at the data. As I said earlier, the data that you've gathered is actually quantitative data. So there's not a lot of analysis in that sense. So here you have your planning group, all the people that have been working on this all along, all the people that have been helping to administer the assessment, and you have education, employment, health, housing, transportation, and your clients, all of them at the table. But this time, information is flowing back and forth. You're giving all the information to each of these groups to look at. The information itself already tells them what is need number 1, number 2, and number 3 in their area. So the data already tells them that. So they have an opportunity to look at that and say, well, why? And what other information can we gather that supports that? And what are we going to do about it? So when it's time to write the report, you have not just the hard data, but also some analysis to explain to people who may not be in that field of work why that is the number 1 need or 2 or 3. So that's part of the analysis process. And there are multiple levels of data. The way that this looks is you start with the under-resourced clients of partner agencies. So that's your data pool. You're not interviewing everyone in the community. You're interviewing specifically a targeted audience, and it's usually individuals that are clients in these organizations. Then you're looking for their responses. How many of them have those key indicators that we talked about earlier? The key indicator for each research area. So you're narrowing your focus again. Now you have a smaller pool of people for whom you're going to determine the needs. That would be community level data. Then you determine what are the top needs for the individuals that have that key indicator. So for those individuals that don't have a high school diploma, what are those persons' top needs? And then we have additional very critical factors we're going to look at in just a minute that would help. If you've decided you're going to build a program based on this information, what additional information do you need to know about these human beings that you want to help? What other critical factors are there? So let's look at education. Our data pool, this young lady happens to be part of that pool of people that we interviewed, and 20% of those that were interviewed did not have a high school diploma. All those clients and nonprofits, 20% of them didn't have a high school diploma. Out of that group that didn't have a high school diploma, their top needs were a GED, adult basic education, and tuition. So that's organizational level data. But then if you're designing a program, implementing a program, these are things that I believe, and our members at Ethan believe, are critical characteristics that can help you design a program that's either going to be utilized or not. No one's going to show up. And one is, how many of them live below federal poverty guidelines? That has to do with, can we provide access to benefits that they may not be receiving now? Are they experiencing hunger? Do they have internet? Do they have children at home still? Are they suffering from depression or anxiety? Do they have a disability? And do they have a phone? Those are little details that combined help you design a program, because you can design a program ensuring that maybe there are snacks there or a meal, that if they don't have access to the internet, but it's critical that they have a tablet, that you provide hotspots for them. If they've been diagnosed with a disability, you can do in your initial assessment an evaluation of what benefits might be available that they're not receiving right now. Clearly, if there are issues of anxiety and depression, then those that are providing these services need to be well informed about behavioral health issues, behavioral health conditions. And so this is the one for education. And I'm going to show you all of them, but you're not going to get to read them all, because here's the one for employment. So for that subpopulation, key indicator was unemployed. 11% of them were unemployed. Those were their needs. For healthcare, 27% did not have healthcare coverage. And somebody mentioned earlier, the top need for that group was dental care. Then for housing, 4% were experiencing homelessness. For transportation, 32% said they did not have reliable transportation. You can also then look at the data, not just by each of those 5 areas or more, whatever you end up with, but you can also look at what were the top needs overall for your community. And you can see by the color coding, all the blue is healthcare. So out of these top 10, 1, 2, 3, 4, 5, 6 of them are healthcare needs. That says a lot. The living wage was one of the top needs, and then the 2 purple were employment, computer skills, career and job training, and then under education, it was adult education. So you can look at each area, and then you can look at the whole to see what the top needs were for that entire group. So let's talk about analysis. Let me open up the questions. What questions do you have about analysis, specifically about analysis? This is a good question from Adam. Do you believe there might be data missing since all respondents come through partner organizations? Yes, it's possible. There are many people out there, especially in rural communities, and in East Texas, we're really scattered, that are not coming into organizations for support. So yes, there is definitely opportunity for us missing individuals and what their needs are. I think as a whole, it's very comprehensive. When you have organizations in all sectors interviewing their clients, you're very likely to get a representative sample. But yeah, we're definitely going to miss some. Might there be a different indicator and data for folks who are not associated with an organization? Yes, you're absolutely right. It's just very difficult to capture them. The first time we did the assessment in 2013, and we haven't done it since because we received no responses, we actually not promoted, but we put out a press release and the media outlets picked up on it that said, Ethan is conducting a comprehensive community needs assessment. And if you find yourself in need of assistance, it would be helpful for Ethan to interview you. And so that was put out in lots of different media outlets, and we didn't get a single response. So the same pride that's keeping them from walking into an organization for assistance is probably keeping them from following up with them. Okay, wow. So once data is collected, so this is Deborah. Okay, wow. So once data is collected, the software collates and organizes, right? That's the qualitative data, the numbers data. Quantitative, yeah. So quantitative data is numbers data. And you're right, that's exactly what happens. All of the data is accumulated and you sort it and you figure out for every single question what are the top 3. And then we focus on those key indicators for each of those study areas. And so then when we develop goals for our councils, those groups of people in different areas, we call councils at Ethan, when we gather that information and give it to them, they get all the data, but they're really focusing on what were the top 3 needs that the data proved or showed for their research area. Yeah. Let's see, a lot of people don't trust what is done with the data and therefore don't want to participate. Maureen, you're right. Some people won't participate. And I think that that's what we saw when we had volunteers, individuals who the clients didn't know. asking if they would participate in a survey. More often than not, they said no. And so the only way to make this work is if you have a trusting relationship. I mean, the value of the data is tremendous, but you can only get it if you have a relationship. And it's the reason why we go through partner organizations. We know that they are working with people who are under-resourced. That's our target population. And then we want those that already have a trusting relationship with their client to actually conduct the interview. So you're right. There are some who don't respond because they don't trust where the data might end up. It's also anonymous. It's also voluntary. So we have a lot of ways of allowing people to exclude themselves from the assessment if they don't want to be. Let's see, Rima, do you include questions about how existing services are meeting existing needs, or is that part of the pre-process to develop the assessment and the analysis, then should lead directly to program design or improvement independent of analysis of existing supports? So there are questions within the assessment about not just where was this interview conducted, so people can put on there, it was at Goodwill Industries, it was at Samaritan Counseling Center, it was at PATH. So we know where they were, but we also ask them what services in the community are they receiving? And there's this long list of organizations and the services that they provide. Sometimes I think we ask way too many questions, but that's where that would come from. We would know whether or not people are already receiving assistance. So yes, you're right. I mean, somebody might say, I'm experiencing homelessness, and the data might assume then that that person's on the streets still, but they could be in a shelter or supportive housing or something like that and still label themselves, call themselves homeless. But we do try to capture information that balances that out. That kind of data has to be analyzed. That's the kind of data that goes back to the council, and they can look at that information and then determine what organizations do we have that address this top need. What organizations do we have? Who do they serve? How many people do they serve? Do we need more of them? Do we need to enhance what they already offer? Those are the kinds of things that we see. Have you ever used Getting Ahead grads to do interviews? We did Getting Ahead for the first time in our community 2 years ago, and Getting Ahead grads had not finished their course when we did the comprehensive community needs assessment. Now, once we gathered the data, all of that data did go to some of our investigators. They were able to look at that data and help. We're still working on, and haven't been quite successful, but COVID, I think, is what really threw us, made it not work. We're still working on having a council of investigators and or within Ethan, and or having a representative GA grad investigator in each of our councils, at least one in each of our councils. So we understand they have tremendous strength to bring to the table, and we want to make sure that we work with them, that we allow them to help us and to be part of that solution. We can't do it without them. Do you ever offer a stipend to the client to do the assessment, or do you feel that changes the focus of the response? Right, the ethics guidelines for research of human beings does not allow us to provide a stipend to those individuals who participate in the assessment. Now, we now have an online social services directory. When we did this assessment in 2013, we had a printout. We had a printout of all the organizations and the services that they provide. And when we conducted an interview, we gave that to people. So they did have something valuable and tangible that they could take with them. Oh, Timothy said, we conducted a very successful survey utilizing grads. That is great to know. We definitely want to do that. We just haven't been able to. Now, we're not going to do this assessment in our community again until 2022, the big comprehensive community needs assessment. We'll probably do other smaller assessments, but we're not going to do that one. Okay. So let me show you some of the results. The research area, economic well-being, the key indicators, whether or not they lived below the federal poverty threshold. In 2013, let me see, this is covering up my thing. I can't see what that last number is, but in 2013, it was 65%. We're living below poverty. 2016, it was 62%, and in 2019, it was 53%. So that's probably says 12% change on the end. For education, less than a high school diploma, 33% did not have a high school diploma when we did it in 2013. In 2020, that had been reduced to 20%. That was great. Unemployment, the first time we did the assessment, 42% of individuals were experiencing unemployment. And when we did it in 2019, it was 11%. And we all know that before COVID hit, our economy was doing better, employment was doing better. And in the state of Texas, and specifically in this area of Texas, of East Texas, employment was thriving. People had jobs, not necessarily well-paying jobs, but they had jobs. So we expect that this number is going to be very different next time we do it. Healthcare, the no healthcare coverage, first time we did it, 44% did not have healthcare coverage. The last time we did it, 27%. Lots of organizations in this community became assisted with the Affordable Care Act application process, and it came as a result of this. Housing, people experiencing homelessness, first time we did it, it was 13%. 2016, it had gone up to 18%, and then 2019 is down to 4%. Now, it's important to note, and you can put it in your details, and this data right here is not going to help you design programs. It's just looking at the big picture, right? Your dashboard report. That we don't believe we were able to reach a lot of the people experiencing homelessness because we had so many volunteers. That number specifically is one where that council felt like it's really not indicative of what's happening in our community. It's still part of our dashboard. It's still part of our up and down of trend lines that eventually will let us know where we are. And then for transportation, the first time we did the assessment, we didn't even ask whether people had reliable transportation. We did ask questions about transportation being a barrier to services. And so it was after that we developed the Transportation Council. We didn't have one before. The data showed us we needed one. Still, we've not made any progress. We have more people without transportation now than we did when we did it 3 years ago. Now, this is something important and something that kind of shook us when we first saw it. Was in 2013, we actually found 17% of the people interviewed had all of the indicators. No high school, no employment, no healthcare coverage, no home, and no transportation, all 5. 17% of the people had all 5. In 2016, it went down to 12%. When we did it in 2019, we didn't find a single person we interviewed that had all five indicators. So this is something when you're feeling overwhelmed by this data, and it can be overwhelming, that I love to use. I love this quote: our present circumstances don't determine where we can go, right? They merely determine where we start. So I love this quote, and I wanted to be sure to share that with you. So we're capturing the voices of experts in poverty. The purpose is the data, the education, the advocacy. You're working together to design it with stakeholders, with universities, ensuring you have the components you need. Your collection is through your partners. You make sure they're all trained and you monitor the process. And your analysis, again, is your stakeholders. You have different levels of data and you're able to measure progress over time. So that's a comprehensive community needs assessment. The last 3 slides are just about who we are. We do collective action, and it says when we work together towards shared goals, we can solve complex challenges that impact our community. We now offer all of the AHA process programs, courses. We have facilitators and trainers for all of those. We find that without it, we wouldn't have been able to make as much progress as we have had. We all have a common language. Individuals in all of those sectors that are Ethan partners are participating in all of these courses, gaining the same knowledge, building relationships, and having more positive outcomes. So we're grateful to all of the work of AHA Process, Dr. Ruby Payne and Phil and Jean and Ruby and Ruth and so many others, amazing human beings that I call my friends. And then 903help.org. This is important because this is something that's actually easy to do for communities, which is to build an online social services directory to ensure that people can find help in their times of need. Many of you probably already know the partner, Simon Solutions, that makes Charity Tracker. Simon Solutions and Charity Tracker, as they use software also to capture getting ahead data. So what we did is we gather all of our partners and we developed an online social services directory. Each partner is responsible through a liaison to enter all of their programs. That database has Google Maps in it, and it also has a Google Translate button, so they can translate all of that data into 15 different languages. So our job really was to recruit the partners, help design this database, really the online social services directory, and then stay on top of them to make sure that the data is always up to date. And then this is just my information slide. Please let me know if I can help. You will get a copy of this presentation, or you can pull it down right now from AHA Process. ethnn.org is our website. That's my office number, 903-216-3211. Send me an email, Christina@ethnn.org. And I'm not sure how much time we have left. How are we doing, Jean?
You have 3 minutes, so you've done extraordinarily well. I just want to say that if this is one of my regrets about doing this stuff online, is that right about now we'd all be giving you a standing ovation.
Oh, yay!
Yay, this was an absolutely wonderful presentation, especially for those folks out there who are running these types of organizations, and you've been able to lead them through some very helpful hints, tips, strategies, to-dos. You've increased everybody's workload. They're gonna go this afternoon. You're gonna go, wow, I gotta be doing more of this.
No, but then you have it. You can do so much more.
Yes.
Yeah.
There's a few housekeeping things you'll find in the question box. The chat box does not work for all attendees under this particular GoToWebinar structure. So in the question box, Mariah has put in there how to go ahead and go to the presentation, Ruby's final presentation for the day, here starting up in just a few minutes. You will also, you should have received at about, well, 45 minutes ago. I'm not going to say a time because this is confusing for everybody, but about 45 minutes ago, you should have received a link for to click to go into then the final presentation for this wonderful conference from Ruby. Do you have any final words of wisdom for the folks here, Christina, before we sign off?
You can do this, and you don't need a bunch of money to do it either. You just need people who are willing to do the work. And if they have relationships with their clients, they're willing to ask them a few questions, you're going to have invaluable data with which to build an amazing network, pool resources, get philanthropists on board. It's not hard, it's just work.
Okay. Mariah, if you're still able to hear us, is there anything additional from a housekeeping perspective people need to know about?
No, that's pretty much it. I just reposted that the link for everybody to join the general session, and I believe Jawanda sent out the link to the handouts for everyone to be able to download those. Other than that, I think we're good.
Okay, and that was my timer going off in the background saying we are now officially toast. So
thank you, Jean, for leading, and Mariah and Jawanda for helping us out. I appreciate it.
Oh, it was wonderful. Thank you very much, all of you. And I noticed that everybody stuck around to the very, very end out of respect for you and the work you do there in Tyler, Texas. We're still at 175 people.
Yay, so, that's great. Okay. Thank you all so much.
All right, bye-bye.
Bye-bye.